I'm your paramedic for today. My name is Annabelle. What is your name? Can you hear me?
Yes, can hear you. My name is Billy.
My role as a paramedic is to provide rapid response, emergency medical assessment, treatment and pre-hospital care for the patient. Introducing myself to the patient is vital as it builds empathy, develops a supportive and caring relationship and lets the patient know they are in safe hands. Okay, William, what seems to be the problem for today? It looks like you have broken your leg.
Go.
My team has let your family know of your circumstances and they are on their way to the hospital now. Informing William of the condition of his family reduces stress and builds a strong trusting relationship with the patient.
Thank you so much for letting my family know. I was very concerned.
It looks like you're in a lot of pain there, William. Where does it hurt the most? I'm going to administer yourself some morphine to help remove the pain so you're in less discomfort. Do I have your consent to do so?
Yes.
Gaining consent from your patient is critical. Consent represents the ethical and legal expression of a person's right to have their independence and self-determination respected. We're going to take you to the Royal Brisbane Hospital now, William, where your family are also there waiting. We're now going to carefully move you to the ambulance so that when you arrive you receive the required treatment for your circumstance. When the ambulance arrives at the hospital, it is very important for the paramedic to let the nurses know in detail what has happened to ensure the best decision is made for William.
From Brisbane Hospital, and I've received some information about your condition from paramedic. I'm really sorry to hear about your tragedy. What happened to you? It's noticed that you have taken some morphine from paramedic, is it right?
Yes.
Does the morphine can help you to reduce the pain, or does your
It has to be a bit unstill there to be.
Yeah, sure. But before I can give you proper treatment, I should know more exact detail from the ones. So I suggest that having an imaging is unnecessary. Would you like to do so?
Yes, please.
Yeah, I'm also inform the conditions to family members, so you need to be worried. So no need to be afraid. As a caregiver and communicator, giving care to a patient is not enough. We must also inform their ensure their family members and clear explain what happened and what treatment and procedure happening to the patients. So no need to be worried. I will inform family about your proper treatment for treatment conditions.
Thank you for that.
You're welcome. You will receive medical image from Bianca, the medical image as soon as possible.
Okay.
As Mr. Jones has sustained serious injury to various parts of both his lower limbs, it is crucial that he will receive X-rays and CT scans. This will identify serious damage which has incurred throughout this traumatic ordeal. This is where my role as Mr. Jones's medical imaging technician becomes vital in the triage of his emergency and aftercare within the Royal Brisbane Hospital. Hi Mr. Jones, my name is Bianca and I'll be looking after your medical imaging for today. Would you like me to further explain my role within your care today?
Yes, please. That'd be great.
Mr. Jones, it is my responsibility to prepare you for your scans through correctly positioning you and ensuring that your comfort and safety are my #1 priority. Additionally, I must ensure no errors are made throughout the course of the following lower limb radiographs. Furthermore, Mr. Jones, I must inform you of the very low risks of radiation in which you'll be exposed to and reassure you of any further concerns. Most importantly, it is my role and responsibility to ensure that I inform you of the injuries in which you have sustained. Mr. Jones, do you feel safe, well informed and comfortable for me to carry out today's intended diagnostic procedures?
Yes, I do.
Excellent, I'll see you in a minute. Once the images have been captured, I then analyse them with the radiologist for preliminary findings. Interpretation of these indicated fractures to his left femur, tibia and distal end of his fibula. These were then shared with William's doctor, nurse, podiatrist, pharmacist and of course Mr. Jones himself. This interclinical communication between allied health professionals is extremely vital in providing the utmost suited care and management plan for Mr. Williams following his accident. In particular, I have had the most contact with Mr. Jones's nurse and podiatrist, as they were the members of Mr. Jones's healthcare team who in which were the main individuals providing his required care within the hospital setting and further recovery of his lower limbs. Although my time with William was short, my role within his diagnosis and treatment is crucial for an effective patient-centred care recovery.
The role of a podiatrist is to examine all aspects of the lower limbs, focusing mainly on areas such as paediatrics, diabetes, sports injuries, structural problems, and treatment of the elderly. As a podiatrist, it is extremely important to build a professional relationship of trust between health professional and the patient. Hello, Mr. Jones. My name is Archer. I'm the podiatrist. How are you feeling today?
Good, thank you, Archer.
I'll be dropping in to assess how your car accident injuries are going. The medical images report shows various fractures and shows you have a case of moderate chronic bilateral osteoarthritis. I'm just going to examine your whole leg to assess the fractures. Is that okay with you?
Yep.
Thank you for your cooperation, Mr. Jones. Firstly, from observation of the medical images and my examination of your feet and joints, I've seen no anomalies. Good. For now, I recommend no exercises that will aggravate the pain. I'll give you a list of stretches to perform when you're feeling better to help strengthen your joints. Due to the deformity in your right foot, I'm going to suggest that a shoe insert or orthosis might be helpful here. Podiatrists can prescribe foot orthosis to reduce a patient's pain and prevent the risk of further sprains and injuries. If the condition gets any worse, please do not hesitate to make an appointment and come and see me. Remember to do those stretches. Hope to see you back on your feet soon, Mr. Jones.
Thank you.
Hello, Mr. Jones. I'm Ryan. I'm your pharmacist. Before I begin, would you like to know what I do around here?
Yes, please.
Put simply, I'm keen in the process of prescribing medication. However, in more depth, I observe and optimise patient drug use and are important in quality management, documentation and standardisation of interdisciplinary processes. As a pharmacist, I am required to maintain collaborative relationships with other healthcare workers as a formal integration is necessary to uphold my specific duties. More specifically with this case, I'll be simply prescribing the required medication for you and I'll inform you of programs which can assist you in recovering from your traffic accident. However, before I proceed, I need to know any existing medications that I don't know about. I have that you take rosuvastatin once a day, paracetamol two tablets 3 times a day, and you purchase glucosamine over the counter. Is that right?
Correct.
Okay, so there are several different drugs useful as a treatment, and I prescribed you with benzodiazepine, which is a muscle relaxant to reduce the pain. However, I must warn you, this can be addictive and may lead to a dependency on the drug and memory impairment and withdrawal. Are you okay with that?
Yes, I use it to a minimum.
Also, if you would like, I can prescribe you with antidepressants as there are several mental health consequences attributed to an injury of this nature.
That won't be necessary.